I think we have to be really careful with that term systemic, and I try to avoid it at all costs, because in the MD world, systemic Candida means that you have a Candida, like basically Candida sepsis, right? The Candida is growing in your blood. And that is not at all what I'm talking about. I mean, that does occur with like HIV and really sick patients, and that is a huge medical emergency. I really just think of it as like, is that dysbiosis Candida overgrowth. So you can have yeast overgrowth, right? Or fungus overgrowth on your skin, and that's like ringworm or athlete's foot. You can have Candida overgrowth in the vagina. I've seen it, by the way. Sometimes it overgrows in the bladder, so that women that have irritated bladders can have it there. I have a lot of patients that overgrows in their ear canal. I mean, I guess that's really the skin, but I've seen it there. Of course, thrush in the mouth. I just treated a patient this week that had it overgrow in her mouth. But I think we're really looking, when I'm kind of, if I sort of think of the body, there's sort of the outside and the inside. But I think of your digestive system as still sort of outside of you, right? So if you think of your digestive system, it's just a big tube running through you, starting through your sinuses and going out, but it still is sort of outside your body, even though it's inside of you. That reminds me, of course, a huge area that I treat for fungal overgrowth is the sinuses. And actually that can be quite tricky, because if you have fungal overgrowth in the sinuses and you're just treating the gut, you can never get on top of it, because where do your sinuses drain? But into your gut. So if you're constantly having, if you have fungus overgrowth in the sinuses and it's constantly having postnasal drip in the gut, if you're just taking something to treat the gut, you're never going to get to the core of the problem.